Are you ready to inject TREMFYA, also known as guselkumab, using the One-Press Patient-Controlled Injector? TREMFYA is given as a 100 mg injection under your skin that you only need to take once every 8 weeks after 2 starter doses at weeks 0 and 4. Your first self-injection may be performed at your healthcare provider's office, so he or she can show you the right way to give yourself injections under the skin. After this training and with your healthcare provider's approval, you may be able to inject at home. If you do inject at home, remember that TREMFYA must be stored in the refrigerator at 36 to 46 degrees Fahrenheit. Do not freeze your One-Press injector. Do not shake your One-Press injector. Keep your One-Press injector and all medicines out of reach of children, and keep it in the original carton to protect it from light and physical damage. What follows are instructions for how to inject TREMFYA using the One-Press injector. But first, carefully read the instructions for use and medication guide enclosed in the carton before you or your caregiver injects TREMFYA and each time you get a refill. This video will help you get comfortable with using One-Press injector to self-inject TREMFYA as prescribed by your healthcare provider. It's important that you don't try to inject yourself until your healthcare provider has walked you through the whole process. Let's get started. Let's first familiarize ourselves with the One-Press injector itself. On the left side of the screen is the One-Press injector before use. You see the handle, the teal body of the device, the window where you can inspect the liquid, the needle guard, and the bottom cap over the needle guard. Do not remove the bottom cap until you are ready to inject. On the right side of the screen is the One-Press injector after use. The One-Press injector is a patient-controlled device, so the medication injects as you push the handle. You can do this at a speed that is comfortable for you. Now, you'll need a few supplies to prepare for your injection. 1 alcohol swab, 1 cotton ball or gauze pad, 1 adhesive bandage, and 1 sharps container. These items are not included with the One-Press injector. Before you inject, remove the carton with your One-Press injector from the fridge. Leave the One-Press injector in the carton and let it sit on a flat surface at room temperature for at least 30 minutes before you inject. Do not attempt to warm the medicine any other way. Make sure you check the expiration date on the carton and do not use the One-Press injector if the date is passed. Do not use the One-Press injector if the seal on the carton is broken. If you find this or any other damage to the carton, call your healthcare provider or pharmacist to get a new One-Press injector. Next, choose one of these injection sites. We recommend the front of your thighs. But you can also choose an area on your lower stomach, but never within the 2 inches around your belly button. And if you have someone giving you the injection, the back of one of your upper arms is also an option. Remember, do not inject into skin that is tender, bruised, red, scaly, hard, thick, or is affected by psoriasis. Wash your hands well with soap and warm water. Next, clean your chosen injection site by wiping it with the alcohol swab, then allowing it to dry. Do not touch, fan, or blow on the injection site after you've cleaned it. Take your One-Press injector out of the carton. Take a look at the liquid in the viewing window on the One-Press injector. It should be clear to slightly yellow and may contain tiny white or clear particles. You may also see 1 or more air bubbles. All of this is completely normal. Do not inject if the liquid is cloudy, discolored, or has large particles. Call your healthcare provider or pharmacist and ask for a new One-Press injector. So, it's been at least 30 minutes since you took the carton out of the fridge, right? Now, take the One-Press injector and pull off the bottom cap. Make sure you keep your hands away from the needle guard after the cap is removed. It is normal to see a few drops of liquid. Make sure you complete your injection within 5 minutes of removing the cap. Do not put the cap back on. This could damage the needle. Do not use the One-Press injector if it's dropped after the cap has been removed. If this happens, call your healthcare provider or pharmacist to get a new pre-filled One-Press injector. Place the One-Press injector straight onto the skin at the injection site. Push the handle all the way down until the teal body is not visible. This is very important. Do not lift the One-Press injector during the injection. If you do, the needle guard will lock, showing a yellow band, and you will not get the full dose. You may hear a click when the injection begins. Keep pushing. If you feel resistance, keep pushing. This is normal. The medication injects as you push. Do this at a speed that is comfortable for you. Confirm that your injection is complete. The injection is complete when the teal body is not visible, and you cannot press the handle down anymore. You may hear a click. Then lift straight up from the injection site. The yellow band will tell you that the needle guard is locked. Now, all you've got to do is a bit of cleanup. First, put your used One-Press injector in a sharps disposal container right away after use. Do not throw away or dispose of your One-Press injector in your household trash, and do not recycle your used sharps disposal container. Make sure you dispose of the bin and its contents as instructed by your healthcare provider, nurse, or pharmacist. For more information, please read the section on disposing of TREMFYA One-Press injector in the instructions for use. There may be a small amount of blood or liquid at the injection site. Hold pressure over your skin using a cotton ball or gauze pad until any bleeding stops, but do not rub the injection site. If needed, cover the injection site with a bandage. Congrats! Your self-injection with TREMFYA and One-Press is done. When it comes time for your next injection, this video can serve as a great refresher if you're feeling a little rusty about the process. So definitely come back and watch it again. Remember to read the instructions for use before using your One-Press injector, and each time you get a new one. There may be new information.
Please reach out to your healthcare provider with any questions you may have about your treatment. If you need additional injection support or would like information about a program to safely return your used devices at no cost to you, you can connect with a TREMFYA With Me nurse guide at 1-833-WITH-ME-1, 833-948-4631, Monday through Friday from 8 a.m. to 11 p.m. Eastern Time. Thanks for clicking with TREMFYA and the One-Press. Selected important safety information. TREMFYA is not for everyone. Only your healthcare provider can decide if it's right for you. Do not use if you are allergic to TREMFYA. TREMFYA is a prescription medicine that may cause serious side effects, including serious allergic reactions, infections, and liver problems. TREMFYA affects your immune system. It may increase your risk of infections and lower your ability to fight them. Please read the important safety information located on this website and the medication guide for TREMFYA to learn more about these and other risks for TREMFYA. Discuss any questions you have with your healthcare provider.